So the benefits of root canal therapy are this: if you have a tooth, you're either in extreme pain or you have a old filling that may not be bothering you but is very close to the nerve. The benefit of root canal is, well, for one, if you're in pain, is to get you on out of pain, to help restore and keep a tooth. The other situation is if a tooth has a cavity and the cavity is very, very close to the nerve, we'll often recommend a root canal before what we call restoring the tooth, which usually ends up being a crown. Because often if you have to remove a deep cavity, it could be so close to the nerve that by the time the numbness goes away after we treated you, you could actually have pain. The main benefit of root canal therapy is to take a tooth that has still a lot of its structure left, but you're having a problem, is it allows you to keep that individual tooth. And once root canal is done, it's very important that you get the restorative work done on it, which usually means some sort of build-up or a post, or with a post and a crown, because if you don't actually do that, the tooth is very, very likely some point down the road to break. So root canal therapy, even though I do lots of dental implants, if a tooth can reasonably be saved, you're having some pain, then we would definitely recommend a root canal so that you can keep your own tooth, or as I say, there's nothing better than the teeth that you were born with. The difference between root canal therapy and tooth extraction is a tooth is going to be extracted if there's not enough tooth structure left that once, let's say, the root canal is done, I can actually rebuild the tooth, or you can put the tooth back into function. Often a tooth that's being extracted is one that is non-restorable, has lots of infection, it's loose, tooth is broken, hardly done to anything. Teeth like that are not often good candidates for root canals, no more than if you have a tree stump, you will not build a tree house on a stump because there's no structure. Root canals, again, are there to save teeth that for the long term, 5-10 years down the road, you still be able to chew and eat with it, even if it has a crown. If not, then we have to consider taking out the tooth, and then we can explore your options after that. After the root canal therapy, you can expect to have some soreness for a few days, but we will usually treat you with antibiotics and something for pain. And you often, once the nerve is removed and the root canal is done, really, honestly, your pain should be going away in a relatively short period of time. Pain that if you were having a lot of pain, should be gone relatively within the next day or two. So these days, with the materials that we use, you should not expect any long-term pain or sensitivity.